Hey, Pete.
What?
We're rolling.
We are. Okay. All right. My marshmallow still isn't done yet. It still looks like the top of Justin's head.
Let's just keep rolling. Let's do it.
Welcome to the Chief Roast. It was the year 2022, and our exceptional cadre of chief residents were just approaching the end of their academic year. Before the completion of their residency, Amy Davis, our fearless program coordinator, asked that they complete a final ACGME personality survey. They understandably put it on their desk, and there it sat for an incredibly long time. For those who don't know, residents are about as good at completing clerical tasks as Dr. Porter is at having children one at a time. Not surprisingly, Amy had to return 52 more times before they finished the surveys.
Okay, what do we got?
So right now we have 4 patients down in the ED. We had 3 traumas that came in during the day, and there's 2 traumas that are on their way from North Country. One was an MVC, is stable. The other one was a accidental self-inflicted gunshot wound to the leg, and it sounds like they're a little bit unstable. And as far as the Hey Spencer, so remember we discharged that patient. They're refusing to leave. I was in the room, but they're requesting you specifically, and they want you to go in it.
You know what? You do it yourself, okay? You have to go in there and take care of this, okay? I just can't. Yep. Yep. But what's your question? No. I really want to know, but what is your question? Okay, fine.
All right, Dr. Course, want to run the list?
Sure.
All right, first patient, 407A. This is a 45-year-old male. He has the NSTI left lower extremity. He's MPO at midnight. We're going to take him to the OR today. Next patient, 410A. 81-year-old male, admitted with a small bowel obstruction. We got an NG tube overnight. We're going to do a contrast challenge today. Strict MPO for now. We'll see how it goes. KUB later. Next patient, 410B. This is a 36-year-old male. He's got a bunch of drains in. They're all a disaster. He's going to IR. We're going to see what we can do with it. We'll see what they say. Next patient, 426A. She has incisional pain. She had a hernia repair done. I don't know what's going on with her right now. We're going to figure it out. I went to see her. She's looking a little bit better this morning. Got a bunch of pain meds. She's got a drain in place. We're going to leave it in there for 2 weeks. She's going to follow up with us in clinic, and it's going to be great. Next patient, ICU 12. They have alcoholic hepatitis, a colonic ileus. Not looking very good. We got to see what's going on. All right, Dr. Torres, I think we need to diurese this patient. She's a contraction ankylosing, so I want to use Diamox.
Why do you want to do that, doctor?
I moonlight in the CVCC. We use this all the time. I'm very comfortable with this medication.
I think that's a bad idea.
We've been doing tons of things with this patient and nothing has been helping. I think that we need to do it. I'm sick of this shit. I am fellowship trained, critical care certified. I want to be making these decisions. Come on, Noah.
Can you help in here? Someone's back exploded.
Noah, go ninja that. I can't be bothered with this. I'm critical care certified. Come on, we're gonna be late for rounds. Okay. Porter, what are you doing? We're taking the elevator. We always take the elevator. I even bought a house with an elevator.
We're on the same floor.
Even though Dr. Elia Porter was destined to complete a critical care fellowship and be an excellent surgeon, she still had to endure her bumps in the road.
Okay, Dr. Reinhardt, 3009 was crazy last night, but the consult I really want to talk to you about was a guy that came into the ED with bright red blood per rectum. The good news is his rectal exam was completely normal. The bad news is I did it on the wrong patient.
Wrong patient? Listen, no. Let me tell you something. Back in Iraq, if you put your hand down the wrong hole, that's how you blow off an arm.
Ugh, why can't they stop paging me? I just need a second of rest. Who put this here? Justin!
Hey, Natalie.
Hi, Justin.
I just wanted to tell you did a really good job managing that hypotension for our patient last night.
Oh, thank you so much.
You're doing really great this year.
Thank you.
Wait. Is anybody else curious what Justin looked like before all of his hair made a mass exodus to his face? Can we find some footage on that? We have something? Okay, great. Yeah, let's run it.
That Edie wants me just to lay hands on. I need a snack. Let's hear. Oh my god! It's a roadie.
Greetings, my fellow residents. I would like to occupy a brief moment of your time this evening to pass along a humble invitation to a quaint night out in White River Junction tomorrow night. I trust it will abound with warm fellowship and copious laughter. Kindly respond by tomorrow afternoon so I can arrange for appropriate reservations.
Ooh. I think we had the wrong email. Can we play the other one?
Yo! Tomorrow night, y'all, we're gonna paint the Upper Valley red with the blood of our devotion to living the good life together and getting rowdy dowdy. I'm getting wheezy just thinking about it. Truth. Picture yourself, together with your best friends, a cold beer in your hand, the cranberries on the jukebox, tomfoolery, camaraderie, laughter gonna literally smack you in the feels box. Let's go! Get stoked.
Woo! Hey, what's up, party people? What are we doing this weekend?
I hear Rob's throwing a rager. It's gonna be sick.
That sounds great, but where's Rob?
I haven't seen him.
No idea.
Oh, man. Last night was wild.
Mark, what's up, dude? Yo! Oh, yeah, we were supposed to go to White River. Yeah, I got a little overserved last night and... Yeah, I'm on some island somewhere. Yeah, I'm sorry, we'll have to do a rain check.
Yo, Robin, I see that you're taking care of Mrs. Jones and putting some orders. She's got overnight vitals, and she's on the sleep study. You know, the whole point of the sleep study is so that patients can get some better sleep overnight. Can you get rid of those for me?
Okay, Rob, sorry about that. Yep, we'll change those orders immediately. All right. But real quick, are you losing sleep over your sleep study?
Yeah, so you got those orders? All right, stay noche.
I would like to take this moment to honor Dr. Rob Allen for all of the countless hours he's put in on Chief Roast videos in previous years. I know personally how much work it takes to make these videos, and I think the best way to truly honor you is to let you roast yourself. Cheers. We are incredibly lucky to have Dr. Santos as our Friday morning instructor for laparoscopic skills. He even has his own YouTube channel in which he records videos for us to practice with. He even has his own YouTube channel. It makes me wonder, what would have happened if his YouTube channel suddenly blew up?
Hey, Dr. Santos, is it okay if we bring your patient back?
What, Gladys?
Is it okay if we bring your patient back? Your next patient back?
Yeah, sure.
Okay.
I have 3 million subscribers on my YouTube channel.
Well, he does have 329 subscribers, and that's not too shabby. Despite how great his videos are, sometimes the residents like to watch some other videos for some different viewpoints.
So one time, we were down in the simulation lab, and I was watching a video on intracorporeal knot tying from the University of Michigan. And Dr. Santos caught us watching it. He didn't say anything, but then again, he didn't come back for the rest of the morning. We weren't sure if he was okay or not.
Dr. Kreitoro is always on the lookout for anything that could ruin an otherwise perfectly orchestrated operation. These are his stories.
Dr. Truboff, one thing I'd like you to get out of this rotation is an understanding and appreciation of the saboteur. There are saboteurs everywhere, Dr. Truboff. Saboteurs of the small bowel, of the Chait catheter, and of the central line in your 9-kilo baby that will miraculously come out in the middle of the night. Do you understand me, Dr. Truboff? Now, okay, Dr. Porter, you have to walk with a purpose, but we always have time for lunch. Now, what's the consult?
Consult is for a 6-year-old male with diffuse abdominal pain, hasn't had a bowel movement in about 5 days, and the ED is questioning appendicitis. They got an ultrasound that is non-diagnostic.
An ultrasound?
Yes, an ultrasound.
What were they trying to see in an ultrasound in a 6-year-old boy? His ovaries? Oh! Saboteurs! Come on, doctor. Oh! Oh! Saboteurs!
This is Tina with Homeland Security. How can I direct your call?
Tina, this is Dr. Daniel Kreitoro. I'd like to report a saboteur.
The next attending we're going to roast is Dr. Aldridge. Dr. Aldridge needs no introduction, but what I will say is that at my first day at Concord Hospital, when I met Dr. Aldridge and we were in the operating room, he said to me, "Just operate. If you up, I'll fix it."
Dr. Eade, welcome, brother. If you're feeling a little bit queasy, you know where to find the chocolate.
Anyway, what the hell was I talking about? Oh, so you don't know what it's like growing up in West Virginia until you see a 12-year-old kid slinging dope in a trucker parking lot to make enough money to buy his mom a pack of cigarettes from the corner store. See, I was probably destined for that life too if I didn't go to the hillbilly school for the gifted.
Geez, Dr. Aldrich, this tibial artery exposure is really challenging.
God damn it, Matt! If it was easy, the OBGYNs would be doing it. Oh, you need to find the saphenous vein? All right, let me take a look. Boom! Saphenous vein. I'm a board-certified vascular surgeon.
Getting Dr. Reinhardt into the medical ICU is like trying to give a cat a bath. Even though he's taken care of more trauma patients than most, he's had to deal with his fair share of trauma over the years.
Dr. Reinhardt, I have a consult. Dr. Reinhardt? Dr. Reinhardt, are you okay?
They were coming in from everywhere. It was a goddamn ambush.
Dr. Reinhardt, who was coming in from everywhere?
Medicine consults.
Hey, Dr. Reinhardt, we have this patient on 4 pressors and we think he may have acalculous cholecystitis. Dr. Reinhardt, can you evaluate this patient for abdominal compartment syndrome? Dr. Reinhardt, do you think you could help me with his central line? Get back! Get back! Get back!
Whenever two big personalities collide, you're gonna get some fireworks. And you're gonna get some owls.
Yeah, bro. Dude, next week, Aspen, all day. Gonna be so much powder. We're gonna be heli skiing.
Where's Spencer? It's 8:05.
We're gonna get some champagne at the lodge. Oh, dude, no. It's gonna be sick. It's gonna be sick.
Spencer, is the patient in the room yet?
I'm gonna have to call you back. No, not yet.
Is the
doctor.
tube in?
I don't think that.
Are the leads even on?
No, they're not. There was a delay. They got your case card wrong, Dr. Bates.
Spencer, I mean, it's gotta be somebody's fault. I mean, everyone's around here is so nice. It's nobody's to blame. We have to, it's a process. But who's at fault? What's going on? It's gotta be the nurse's fault. That's it.
You know what? Whatever. Fine. Why don't you do the frickin' case yourself?
Hey, Spencer. Today we're gonna make this thyroid our bitch.
Hell yeah.
Put your hands up, put your hands up. Let the lights drop, let the lights drop. Make my world stop, make my world stop. Na 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 na. Na 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 na. You make me feel good. Na 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 na. You make me feel good.
Though Dr. Reinhardt has his own effective methods of staffing a consult, Dr. Soybo takes a more holistic approach.
Ah, Dr. Cerrone.
Dr. Soybo?
What can I do for you? Just taking a nice little deep dive into Halstead.
Of course, the ED docs are consulting us. It's a patient who's 65 years old. has had long-standing anemia for like the last 3 years. It seems like they're running out of options with this person, so they're consulting us for a GI bleed, even though they have no evidence of a GI bleed whatsoever.
You know, back in the 80s, we didn't have any of these tests. We just took patients to the operating room, and then we learned all about zinc. It's the gatekeeper. I mean, it really cures what ails you.
This patient might benefit from a peripheral smear. They might be able to find Heinz bodies or schistocytes.
Very good, Dr. Cerrone. We should page the pathologist on call and get a stat peripheral smear.
I bet the emergency department is not even thinking about this stuff at all.
Yeah, that could be. That could be. Well, we're on the case now.
My intern year was not that bad. I'm telling you, I did a skin-to-skin gallbladder my first year.
Cerrone, come on. No, you didn't.
Cerrone. Bro. Pretty sure that's not true.
And that's one of the things these days. People don't appreciate anatomy. You know, one time I was in the operating room and I had to point out to Dr. Sorensen what the levator thyroidea is.
Just no appreciation for anatomy anymore. No appreciation at all. Have you met this little guy?
Levator thyroidea, Cerrone? Really? I've never heard of that. I haven't heard of that before or since. But I sure have taught a lot of people about the muscle of Cerrone.
Woman, where are you? Are you in yet another epic lap chole for a 28-week pregnant lady who has a history of a LADS procedure when she was a baby and a recent redo ventral hernia repair? I guess you might be a while. Lady, try finding some patients who have less complicated problems, okay? Okay, listen. I've been meaning to ask you, has Justin been spotted in a pair of jeans yet? Come on, it's been 7 years. Someone must have caught him dressed down by now. And has Spencer been spotted around the hospital lately stomping around in the bright red clogs that he stole from you? Or is he still on his 3-month vacation, also known as elective? At least maybe Rob has turned your office into a Zen sanctuary with pleasant rivers bubbling in the background and diffusers cleaning out whatever stench still lingers in there from the days when Linshaw and Dan shared the office. Anyway, I'm actually calling because I just got home, and I thought I'd see if I could vent to you for a minute or 2 or 20. I miss you. It was so much easier when we could just PWG between cases, eat some cookies, and hide on the 5th floor when we wanted to talk. Like, remember when we were interns and that polycystic kidney fell off of the back table onto the floor and Dr. Axelrod almost spontaneously combusted in the OR? Was that before or after he told you to get on a step stool to see better, even though you were already on 2? There's so much I'll never forget. So many formative moments. We laughed, we cried, we panicked, we persevered, absolutely crushed it and learned from each other, and we got through it all together. Okay, Bells, I'm going to let you go before your voicemail cuts me off. I'm so proud of you. Beyond proud. There are no words. And I'll see you soon. Remember, I'm moving into your pool house in South Carolina later this summer. Have you told Chris yet?
My intern year was great. I did a skin-to-skin gallbladder.
Blooper reel.
What I'm supposed to.
It's good. No,
What's he
it's
supposed
good.
to
It's
say?
good. It's good.
I need your help in here. Someone's back exploded.
Ninja, go. Ninja.
I've been feeling dry, baby. Trying to hold back.
I think I'm sweating, actually. Can I have one of those paper towels?
Yeah.
Yeah, for the
Your
talent.
face isn't
for the
yeah.
for the talent.
Yeah.
Thank you.
Oh!
Rob's starting a rager. It's gonna be sick. That sounds great. Where's Rob?
Have you met this little guy?
Max, we're inside. We're inside.
Oh,
Max. Max.
Oh!
Did you use the scotch?